What's up, everybody? Dr. Rossi, shrinksandsneakers.com. So I'm happy I'm finally getting a few questions to answer. So somebody had posed a question in one of the comments sections on our video on California rocket fuel, right? And they asked specifically if I could go over the side effects of the two medications that make up California rocket fuel. So I think that's a great topic. I think side effects is one thing that is very common with a lot of these medications. So it's definitely something you should be discussing, obviously, with your physician if you're taking these medications. But I can provide a general overview of what the side effect profile would look like. And I can explain to you how I work with side effects when I'm talking to patients about these medications and what they should potentially look out for. So I'm going to start the discussion with Ventil Vaccine. So Ventil Vaccine is one of the two components of California rocket fuel. So I made a previous video where I discussed the mechanism of action of Ventil Vaccine, but just for review, this is a serotonin norepinephrine reuptake inhibitor. It's primarily used to treat depression, generalized anxiety disorder, social anxiety disorder, and at the VA, in the Veterans Administration, they actually also prescribe it for PTSD. So those are the main indications. There's a few other off-label indications, but for this point and this purpose, those are the reasons why someone might be prescribed this medication. Now, a good thing about this medication recently is that it comes in an extended release formulation, which is a little bit newer than the immediate release. The doses tend to be somewhere between 75 and 225 milligrams per day, and it mostly has a serotonin effect when you're less than 225 milligrams. So what you see is it's primarily serotonin-based drug. At lower doses, at higher doses, you start to get the norepinephrine effect. And again, if you're looking for this California rocket fuel aspect of things, you're going to want that norepinephrine effect because it's going to work synergistically with mirtazepine's effects on norepi as well. So again, serotonin at lower doses, norepi at higher doses. In some cases, there's been heroic doses, what we would call heroic doses, and that would be people using doses of 600 milligrams or more. This is, of course, not recommended in most cases, but at the discretion of the clinician who is prescribing, they may feel like there's some added benefit at higher doses. I would argue that 375 milligrams is the maximum that you would want to go per day with this medication. One of the things to look out for before you start the medication and while the person's on it is high blood pressure. So you're going to want to get a baseline blood pressure when the person comes in, which we normally always do with all of our patients when they come to the clinic. But you also want to be monitoring for increases in blood pressure because it can happen with this medication, especially when you get into that 225 to 375 milligram range where norepinephrine is more prominent. So there is also another risk here, which is a higher rate of death in overdose. So this came out of some UK studies, and it's actually on the UK guidelines. And it basically found that people who overdose on this medication are more likely to have a fatal overdose attempt. And that might have to do with the cardiotoxicity of this medication. So being mindful of that if you are prescribing it. The main side effect and the main thing I want to point out about this medication is that it has one of the most wicked discontinuation syndromes of all the medications. This can be one of the hardest ones to taper somebody off of and stop. If someone stops it abruptly, they risk discontinuation syndrome. So you might be asking, what is discontinuation syndrome and what would I be looking out for? A lot of times it presents as sort of flu-like symptoms is maybe one of the best ways to describe it, but people have also described other weird sensations like brain zaps, vertigo, nausea, sweating, etc. Right? So these are some very common things to look out for if you are having discontinuation syndrome. And brain zaps are like sort of like an electrical sensation that goes on in someone's head, and it can be very painful and disorienting and difficult to deal with. So looking out for those kind of things. How do we deal with that? Well, if someone wants to come off this medication, we're going to taper you very, very slowly over time. In some cases, as little as 1% to 3% every 3 days. So in really difficult cases, you're going to taper much slower. In some cases, you can taper off in a much shorter period of time. It really is patient dependent. So another way that we avoid this is we use extended release formulations. If I'm prescribing Ventil Vaccine, I generally prescribe it as an extended release formulation Or if I'm prescribing some combination like this, I may use something other than Ventil Vaccine. I may use a medication called duloxetine, which has a similar mechanism of action, or I may use the active form or active metabolite of Ventil Vaccine, which is called Ventil Vaccine or Prestige. So it depends on the situation. So with that said, what are the most notable side effects to look out for? So if you are taking this medication, you're getting a benefit for your depression and anxiety, what kind of side effects are you going to be looking for that might be worrisome? So things like insomnia, right? Because this could be a little activating, dizziness, nausea, diarrhea, decreased appetite, which could be a good thing if you're struggling with weight gain, sexual dysfunction, especially in men, delayed ejaculation is often a problem. Sweating, increased blood pressure, headaches, and something called SIADH, so inappropriate ADH release. That's kind of rare, more common in the older populations. The life-threatening things you would like to look out for are the risk of seizure at higher doses, hyponatremia, which if you correct too rapidly the sodium, you can get what's called centropontine myelinolysis, which is sort of like a locked-in syndrome. Very, very debilitating and problematic thing to make a mistake on. And the other thing that's important to look out for is suicidal ideation, especially if you're using this medication in someone younger than 24 years old. And there's been a lot of debate about whether or not serotonin drugs and SNRIs, SSRIs increase suicidality in younger populations. The reality is, I believe that they do, and we should be mindful of it, and we should educate our patients about that risk. So in the next part of this video, I'm going to just go with my fact sheet that I present to all of my patients, and it will give you an idea of some of the most common side effects. I break it down by percentage, makes it very easy for the person to understand. Potential side effects of Ventil Vaccine or Effexor, and I break this down here by percentage, which is important because generally speaking, anything that's over 10% is a pretty common side effect, and you can see there's several things for Ventil Vaccine that are above 10% that you're going to want to look out for. So starting at the top, you can see nausea is very, very common. This is more common at the beginning of starting the medication, tends to get better as the person uses the medication for a longer period of time. But 31%, so almost a third of people who use this med have nausea. Dizziness at 20% is also very common. Sleepiness, insomnia, abnormal ejaculation, which I had mentioned in the previous clip, increased sweating, which I mentioned in the previous clip, dry mouth, which I did not mention, but again above 10%, and anxiety or nervousness at 10%. You can see some other stuff here that's just under 10% as well, anorexia and weakness, constipation, abnormal dreams, tremors, and some other side effects that are less than 5%. So vomiting, abnormal vision, impotence, weight loss, decreased libido, agitation. So this is the common side effects broken down by percentage, and this would be a printout that you could give to your patients when you're prescribing the medication. Makes it very, very easy for the person to see what they really need to be looking out for. And then if they are indeed having some of the more rare side effects, you can also show them this. Alright guys, so I broke down mirtazapine in the previous video, so check that video out if you're interested in the specific mechanism of action. I'll briefly just go over it here. So mirtazapine, also known as Remeron, is an alpha-2 antagonist that blocks alpha-2 receptors. And by blocking alpha-2 receptors, you increase both increase the release of norepinephrine and the release of serotonin. Be mindful that this is a novel mechanism for depression. It is independent of serotonin and norepi reuptake inhibition. It's a very different type of mechanism. Also, you want to remember that this blocks histamine receptors, and when you block histamine receptors, like if you take Benadryl at night or something like that, you get very tired and sleepy, right? So this can cause a lot of somnolence, and it can cause you to feel tired. The indications, the only FDA-approved indication is MDD, major depressive disorder. Sometimes this is used in other cases as well, but primarily major depressive disorder. Generally speaking, lower doses are better for sleep and increasing appetite because you're taking advantage of the side effect profile. So lower doses like 7.5 milligram to 15 milligram are more sedating and the sedation tends to get better with higher doses. So when you get above 15 milligrams, say 30 to 45 milligrams of this drug. Notable side effects. So number one, sedation. So again, this is a great choice for someone who's depressed and cannot sleep. So someone with depression who has a significant sleep disturbance, either because of the depression or just because they have generally a difficult time sleeping, it's a good choice. If you have an elderly depressed patient who's not eating and is losing weight, this might also be a good choice because weight gain is very common along with increased appetite. And in our elderly geriatric psychiatric population, they tend to have this problem quite often. However, for a young adult, this could be an issue, right? You're eating more, you're gaining weight, and you're tired all the time. Doesn't necessarily sound like the greatest choice for younger people who have to work, take care of a family, etc. But again, sometimes there's a time and a place for this medication, and it is pretty effective. Other things to be noted are dizziness, abnormal dreams, confusion, flu-like symptoms, hypotension, and I'm going to break down in another clip the percentages of each of these types of side effects as well as the most common ones that you're going. Ventil Vaccine, here's mirtazapine or Remeron's side effect profile, and you can see there's several things, again, above 10%. So we're looking at sleepiness, we're looking at dry mouth, increased appetite, constipation, weight gain, all above 10%. So pretty common side effects that someone might have. The other ones listed here, weakness, dizziness, flu-like syndrome. The flu-like syndrome could be dangerous if the white blood cell count is low, so you might want to check that. That is something to be very mindful of. The other things here that are less than 5%, abnormal dreams, thinking abnormally, peripheral edema, urinary frequency, tremors, confusion, and muscle pain. So the ones that stand out to me here are the increased appetite and somnolence. And a lot of times we take advantage of these side effects in order to treat certain symptoms that somebody is having. Say you have an elderly depressed patient who's not eating, you might use mirtazapine because you can get the weight gain, you can get the increased appetite, and you can also help them with their depression. And if they're having trouble sleeping at night, they're going to feel tired on this medication. It is very sedating, so they'll be very sleepy on this medication. Another case that this gets used a lot is for people dealing with insomnia. So if someone has difficulty sleeping, it should be in the context of depression, but let's say it's not. Sometimes this medication gets used as a primary med for sleep, again, because it's a little bit safer than some of the other medications we have, like the Z drugs or the benzodiazepines that may be used for sleep. This is a decent choice in that case. And again, we're taking advantage of that side effect profile of histamine blockade. Okay, so that wraps my discussion, another long discussion on two drugs, mirtazapine and Ventil Vaccine, side effect profiles. So we went through all the side effects, the things to look out for, how common they are, what the percentages are, etc. So hopefully this is helpful to that person who asked the question and to other individuals who may or may not be prescribed this medication. If you have any further questions, drop them in the comments section. I will be happy to answer them. If there's other drugs you want reviewed, I'd be happy to talk about different drugs and their mechanisms as well as their side effects. So please like and subscribe to the channel so that we can keep making content for you.